Next, we'll hear from Dr. Kayla Haye. Dr. Haye is an assistant professor of preventive medicine at the University of Southern California. Please join me in welcoming Dr. Haye.
Thank you also for inviting me to share work today with the Roundtable and being part of this great session. I'll be speaking about work on relationships and social networks, and I also have no conflicts to disclose. So the research that I'll share today is motivated by evidence of how difficult it is to change eating and activity habits. And this triangular relapse pattern is well known in obesity interventions, that even when people have access to and can adhere to evidence-based interventions, they often modify their behaviors and weight for a short time, but find it difficult to sustain this in the long term. And this is because people may be able to exert personal agency, choice, and effort to change their behaviors for a little while. But to keep this going, they also need to be embedded in social and environmental structures that support these healthy habits. And many populations, particularly people who are low income and communities of color, are unequally exposed to structural influences that do not support their health in the long term. So increasingly, our interventions are trying to target multiple factors across the layers of individual, social, physical, and macro environmental systems that influence obesity risk. But one facet of these systems that I think we can leverage much more than we have is the social environment, and specifically the rich social networks that make up this social fabric. And this includes our local social networks of family, friends, and community contacts that can influence obesity risk, as well as the global social networks of community members, stakeholders, and decision makers that can and do shape the structural features of the environments in which we live. So in this talk, I'll briefly look at the role that these local and global social networks play in obesity risk, and how they can be leveraged in system solutions for obesity. Before I jump in, I want to clarify that I'm defining social networks as social structures that are made up of social actors and the relationships among these actors. And social networks do not solely exist online. They can represent diverse types of relationships and social actors, such as kinship or friendship among community members, collaboration between organizations, or even partnerships among cities, states, and countries. And social networks are often represented visually, with nodes representing social actors and lines or ties between the nodes representing relationships that can have many different qualities. Social network analysis is a broad theoretical and analytic framework that's used to study the emergent patterns of actors and ties in a network, and often the impact that these social structures have on individual and group outcomes. For example, they've been used to study how friendship networks in high schools are structured based on ethnicity and race, or how patterns of collaboration among different types of organizations that are members of a community coalition. Social network analysis provides a framework to study the emergent features of these social systems, features we start to understand when we study social networks as a whole, such as who occupies knowledge brokering positions that link disconnected communities, and which social actors share close and clustered connections. Research that's examined the links between local social networks and obesity has found that adults and children with obesity tend to cluster together in social networks, and that over time, having social connections with obesity increases a person's obesity risk. Longitudinal research has shown that there are a complex set of factors that explain these patterns. First, they arise because people tend to select or form social ties who are similar to them in terms of health and obesity risk. People often connect to others who are similar to them on many characteristics like socioeconomic status and race and ethnicity, characteristics that are often correlated with health risks and inequalities. This is a phenomenon known as homophily. Propinquity means that people often connect to others through shared social and physical spaces in homes, communities, and organizations. And so we tend to connect to others with similar structural and environmental influences. And finally, there's a lot of evidence that this patterning of obesity in social networks occurs because of weight-based stigma. Individuals with obesity are often socially rejected by peers who do not have obesity. And over time, this results in more social connections forming between individuals who are similar in their weight status, and for those who are overweight to be marginalized and pushed to the periphery of these networks. Over and above these selection processes, we also have evidence that social ties directly influence people's weight norms and their weight-related behaviors through many social influence mechanisms. This can lead to similarities among family and friends in risk for overweight. And additionally, the resources, support, and social capital that are in our networks can impact obesity risk. For example, in a study of the personal networks of Mexican American adults, we found that having more health support in one's personal social network predicted better diet quality, especially for those who experience food insecurity. Overall, it's these dynamics of social selection, social influence, and corresponding shared exposures that give rise to the clustering of obesity that we observe in social networks. And it highlights a critical feedback loop that we want to intervene upon, that people with some of the greatest risks and inequities for obesity are more likely to find themselves in social networks that also confer health risks. And these networks go on to influence and exacerbate people's risk for obesity in the future. I'll end with a couple of examples of intervention approaches that seek to leverage or change social networks as part of obesity solutions. In local social networks, there are two common approaches. The first is segmentation, where at-risk social groups such as family or peer groups are the focus of the intervention instead of individuals. And the goal is to work with the group to promote positive social influence, norms, and support for healthy habits. A second strategy is called alteration, where the intervention explicitly tries to change people's social networks by creating new adjacent healthy networks that can provide positive influences and support. We've applied both of these strategies in an intervention that we designed and are evaluating called Healthy Home, Healthy Habits. The broad aims of this intervention are to promote healthy dietary and activity habits for low-income mothers and their infants, and simultaneously to create healthy changes in the home environment, collective behavior change, and increase their support for one another to adopt healthy habits. And second, we also try to create new social ties between the moms who are in the program through group-based intervention and activities that seek to build meaningful and lasting social connections. And also by connecting the moms to organizations in their community that can support their families' healthy habits. Overall, the goal for these social network changes is to increase social influence, social supports, and resources for healthy habits across the mom's home and community setting. Social network strategies can also play an important role in changing global environments, policies, and broader systems, because it's often networks of community members, organizations, and decision makers who are shaping these spaces. Research that was led by Steve Allender, who will be speaking in the panel later today, used social network methods to map the networks of collaboration among different organizations in a community coalition who were tasked with creating whole of community changes to prevent childhood obesity. In this research, we studied the structure of these collaboration networks and how their actions mapped on to the risk factors that they had identified in a community causal loop diagram. And this provided useful insights and diagnostics about these networks during implementation and a method to study how the structure of these multi-layer networks supported or hindered whole of community change. The last point that I'd like to make is the potential for diverse and novel sources of data to provide insights into these complex social systems and how they evolve and impact obesity solutions. Big data, such as human mobility that's captured on smartphones or networks that are visible in social media data, is starting to provide new and valuable population-level signals of social structures and social mixing. However, as Chanda mentioned before, certain voices, relationships, and social phenomena are likely to be privileged or hidden in different data sources. And so I think it's going to be approaches that draw on the strengths of community partnerships, survey and interview data, and these novel and new sources of secondary and big data that will provide us with the most powerful insights into social networks and their role in obesity solutions in the future. So thank you very much.